Scarring. Any incision on the face, or really anywhere on the body, if it's deep enough, is going to leave a scar. Now, some people heal really, really well. And if the surgical technique is good, if the patient just has good healing qualities, it's going to result in a very thin white line that's kind of imperceptible. That's always the goal. But even in the best of hands, it's not always achievable. I mean, sometimes the scarring can be a little hypertrophied, which means that it's raised.
Yeah.
Sometimes it can be a little indented, and those are all possible things with the lip lift. So it's not to say that surgery was a failure. It's just something to accept as a real risk of the procedure. I think people who do this more often have better looking scars most of the time, but we all run into some problems here and there.
Okay.
So that's important. So if someone doesn't want a scar on their face, this is not a great procedure for them. That being said, there are a lot of things you can do if there even is an unfavorable scar, which happens in a small percentage of cases, but it is possible. So there's laser resurfacing, there's microdermabrasion, there's also a revision procedure, usually that involves a much kind of less aggressive approach to correct the scarring, because you're not like removing a big chunk of skin. So there are things that can be done. So that's the good news. The bad news is that, no one can promise you, invisible kind of area there. So all kind of important points. And the other thing I always tell my patients is that the healing is gradual, especially at the actual incision line. So it's not like at a week, you're good to go, and if you didn't put on makeup, everything would look perfect. But the goal is that about 10 to 12 days, you can start to use scar gel and use makeup on top of that. People really shouldn't be able to pick up that you had something done with that. But I mean, if you were just to kind of let it go, there'd be some redness there that can take months to get better. Some people laser the incision routinely. I don't do that because I think it's re-traumatizing the area, and I think it should only be done if there's an actual reason to do it. So I don't agree with lasering everybody, but that is something that can be done, should someone, require it or want it. I mean, some people have like a visible scar if they don't wear makeup, but they don't really care. So they're just like, I had my surgery, I'm done with this, I don't want any more procedures. And that's fine. So everyone's a little different in that regard, but it's totally normal and actually preferred for me when a patient is thinking about the scarring and understands that it's a real possibility. I mean, there will be a scar. It's just a matter of how noticeable will it be.
Right.
And
Okay.
it does get better with time. It's just that you just have to kind of be patient with it, and sometimes time isn't enough. That's what I'll say about that. But again, most people don't really need anything beyond maybe like a little steroid shot as they're healing at like a month or about 2 to 3 months after the procedure, and that's all they need.